Good afternoon, and welcome to Cornerstone's webinar with the introduction of OhioHealthy. I'm Nelson Culp with Cornerstone. Today we're joined by Sage Shar from OhioHealthy. And before he kicks it off, just one note of housekeeping. If you have any questions, please type it in the question box, and we will answer all the questions at the end of the presentation. And with that, Sage, why don't you take it away?
Hey, good afternoon, everybody. Thank you very much, Nelson, for the introduction, and to Shelly and the rest of Cornerstone on the call. Really appreciate the partnership. But as Nelson said, my name is Sage Shari. I am the senior sales executive here at OhioHealthy. So on today's call, we will be going over several things, right? And how I like to do things is really just start off with an introduction of, who is OhioHealthy and what is our relationship with OhioHealth and, being a provider-owned health plan. And then from there, I'm going to touch on our rate position, go through the products, the small group products specifically that we are releasing to the market, talk about our PBM solution, and I will go over how to get contracted, licensed, quoting, and at the end, certainly last but certainly not least, we will talk commissions. So let's get started. So who is OhioHealthy? Well, we are a provider-owned health plan. As of 1/1 of 2022, we are a wholly owned subsidiary of OhioHealth Corporation. So from a background and history perspective, OhioHealthy was started by a former president of OhioHealth. His name was Dr. David Blum. And what David Blum, his idea, the spirit behind this was to offer the highest quality of healthcare given to the lowest prices within our OhioHealth facilities to Central Ohioans and in our population in Central Ohio. So that's how it started, was to be a community element. When we started, we were a product of a joint venture between Centera Health Plans and OhioHealth. And over the years, simply stated, when a provider kind of engages in this, we had to look at things from a current network contract perspective to a price decrement perspective, savings, and dealing with the wrap network, dealing with vendors, and actually build the company. So we have done that over about a 4-year time span. We started off in the self-funded ASO space, which we are currently in, and we will continue to be in. But as of 1/1 of 23, so January 1st of next year, we will be releasing 2 segments, all within small group. We will have 2 to 50 Affordable Care Act small group plans, which contain POS and HMO plans, and we'll have 5 eligible lives in above for level funded. Like I said, still staying in the ASO space. We bring in an integrated pharmacy story, wellness. You will hear me talk in the future and a couple slides from now about OhioHealth's relationship with HTA, the Health Transformation Alliance, and how benefits like I get as an OhioHealth employee is actually passed down to our members through any segment within Central Ohio. But current state, OhioHealthy, we have a membership of 45,000, which constitutes about 35 to 38,000 of the associate plan. We have Huntington Bank as a client, and we have multiple provider groups, like Genesis, different OPG groups, different imaging labs, etc. So that is our current state. Now, what makes us different, right? OhioHealth has been historically described in Central Ohio. I mean, it's gained in strength over the last several decades, but the proverbial 800-pound gorilla. In our analysis, in terms of the market landscape, there's about 55 to 60% utilization at OhioHealth facilities, and the rest is, segmented between Ohio State and Mount Carmel. But our identity is that our bottom line, our end goal, can be kind of boiled down to OhioHealthy, with partnership with OhioHealth, simply wants better, positive health outcomes for our members. We are, this Central Ohio footprint, but we liken ourselves to be a speedboat amongst cruise ships. We can plug and play when we need to, and you'll hear me to use the word integration. That's what we're about. Where I work in the Blum Administrative Campus, right across 315 in Riverside, I have my chief medical director literally right next to me, the room next to me. Our president of the insurance company, Steven Sindrich, is maybe 5 to 20 feet away, and the 3rd floor, we have claims and claims processing and revenue cycle management. And on the 5th floor is probably names that you would recognize, like, Dr. Steve Markovich, the president of OhioHealth. Carrie Harris-Mueller, our system VP. And OhioHealth over the last several years, I mean, this is like a 2 to 4 year plan, has been hiring from the board level down insurance professionals. So OhioHealth as a board, if you went back in time, we took the good old DeLorean, right, Back to the Future back 5 years ago. Our board consisted of mostly medical health professionals. Now it's a healthy mix between that and healthcare, because OhioHealth has a commitment to not only OhioHealthy as an entity, but to Central Ohio, greater Columbus as a population. So we liken to us as we move as a school of fish. Everyone you contact you, for myself, I live in Gahanna, Ohio. All of the team, all of our back office are Central Ohioans. And I wanted that for a purpose, because, my experience at working at a carriers and my experience of being a broker myself, there's nothing more frustrating when you're trying to serve your member or employer group and you have to reach an international call center, or you're reaching an individual that's several states away that doesn't understand, the ramifications of a certain ongoing issue in your community. This is why we believe we're different. Overall, like I said, high quality, lowest costs in our facilities. How do we do this, right? I know probably a lot of people in their call are like, okay, well, the ACA, Medical Mutual has your facilities in their network. There's other companies that obviously have OhioHealth. Simply stated, our relationship with OhioHealth, we have the best, the lowest inpatient, outpatient discounts in all facilities and everything else. We get a special perk with that full integration. Now, going along the line, what does this become? So I mentioned network contracts. In our ACA and building level funded plans, I would say specifically in ACA, we compared our plans to industry standards, right? The BUCAs of the world. So I'm talking specifically United Healthcare, Anthem, Medical Mutual, and others. And we really wanted to say, what can we do to offer our clients something that's better? I'm sure a lot of us on this call are hearing the same thing from groups. Renewals are increasing. Medical trend is increasing. Inflation, I mean, gosh, we see it at the pumps every day. Everything's going up. How can we make things go down? That's what we're about. And we have seen in our analysis of ACA plans comparing a like product to a like carrier, apples to apples comparison. I have actually seen on the ACA side between a 4 and actually a 22% decrement, comparing our 23 approved plans with those of 22. So that is a big number. And that is something that, we see it's good to give people in the door, but trust me, I care as much about year 2, year 3, year 4, and so on in terms of a renewal, as opposed to just year 1. So we're focused on future state. Now, folks, the second number on this page, 95% member satisfaction, it may seem like, oh, it's normally things are that high, but if you think about it, we have I would say about 75 to 80% of our population is that of OhioHealth. These are medical professionals, these are doctors, nurses, lab techs, et cetera, that are experts in delivering healthcare and in understanding how the system, how the quote unquote game works. And in my opinion, 95% satisfaction from those quote unquote experts is something that's a huge number. And that's why I always say, hey, that 20% may be big, but I think that 95% is even equally as big, if not bigger. So going forward, I stated we have been in the insurance game for about 4 years now. A lot of brokers talk to me, hey, Sage, all this sounds good and fun, but, what have you accomplished? As a broker myself, folks, at a time, I was hesitant with new entrants, things like that. So that is understood. But, what have we accomplished in a 3-year period? Well, we've experienced an 8.5% lower medical trend than the national average. How does this work, right? Like I said, it kind of makes sense when you describe it this way, but lower unit costs, that's that perk we get from OhioHealth. Our disease and care management programs, which I'll talk about in towards the bottom half of the presentation, we don't believe in just self-activation. We understand that individuals have been told, hey, try to exercise more or eat better for decades. And they don't, they may or may not listen to their medical professionals. We actually financially incentivize people via our copay assist programs that we will actually waive the full charge of things such as insulin and inhalers and everything like that for members as long as they're compliant. So with our practices and our protocols and then our unit costs alone, This is how we've been achieving this over a membership base of 45,000. We believe that this same practices can be extended to the market, and that's what we're going to do 1/1/23. So going over, what exactly are we releasing? Well, as I said, Affordable Care Act will be in the 2 to 50 space, level funded 5 and up. Now, our OhioHealthy plans have been coined the term unity plans, obviously symbolizing, the connection between provider-owned health plan, broker, employer. I mean, that forms the community. We see it as a kind of a equilibrium, a collaboration that needs to be really fostered, and that's what we coined the term. In terms of, our back office, we have Trustmark. Now, I will say on ODI, OhioHealthy is a licensed TPA. We're the licensed insurance company. We are good to go. What is Trustmark providing? Well, they are answering phone calls, they are paying claims, and paying commissions. We had a lot of options in terms of a back office. I would say, from my perspective, folks, in terms of, let me digress. If you look at the full package, right, in terms of healthcare delivery, I think OhioHealth, not too many questions with that. What's your next concern with something being viable for the market? Well, I would argue, it's paying claims, paying brokers, answer the phone call. Make sure you're right there for a member, because, it's something I've said before, you really don't know where you're going to go when you're sick until that time comes. And when that time comes, an individual might feel like all the walls are coming down. It can be very scary and tumultuous, and we want to hand carry people throughout this process. We really felt like Trustmark can do that. Now, what else are we offering? Transition to care program. We are not, like I said, bottom line, better health outcomes for our members and for Central Ohio population. We understand we compete with Ohio State and Mount Carmel, but we have a 90-day transition to care program that is for all lines of business, including ACA. Our goal is, hey, if you're undergoing something like a oncology service at the James, that's something that we want to make sure you're comfortable coming into the Bing and our partners in Cleveland Clinic. And for other, procedures, we wanted that ability. So any facility, doesn't matter who it is, we have a transition to care program. Now, big distinction is after that colon, the concierge primary care model. This is specifically and only for our affordable ACA segment. And what is it, right? There is no harm, no foul for not electing a PCP. You actually do not need a referral from a PCP. I always have a caveat on that, as we know on the phone, there are certain specialists that require a referral. There's kind of no ifs, ands, and buts about it. So that process is necessary then. But our mindset is this, right? We've studied the market since 2014, done analysis. We worked with our partners in Milliman and our own OhioHealth actuaries to really get our actuarial values for our plans and put it in the correct metallic tier. And we felt like, hey, over the years, the Bucas of the world and their MIWA and level funded products have quote unquote plucked the underwritten risk from the ACA groups. So we understand, you can use a term if you want to call them, high cost claimants, if you want to say high risk pool, whatever synonymous term. The way we see it at OhioHealthy and OhioHealth, these are individuals and these are employers that need our help. Why do we have a concierge model? Well, we believe if we get these people in day one to the correct care programs and having the primary care act as a proverbial quarterback, well, we can have better health outcomes. And that makes sure that year 2 renewal rates look very similar to year 1. That's our goal. And, a healthy, happy member, it's good for everyone involved. So that is specifically unique to ACA. Everything else is, as is. Now, going forward, guys, the next 2 slides, I will be talking about our 2 networks. So our first one, this is our OhioHealthy network. This is our 5+ in terms of level funded. And keep in mind, this is our network in our self-funded space as well. So what is it, right? It is 12 OhioHealth hospitals. We have Nationwide Children's, Cleveland Clinic, our own primary care within OPG and the CIN, our clinically integrated network. And of course, we had to partner with COPC, Central Ohio Primary Care. Gold standard, in my opinion. They do very good by a lot of our members, and OhioHealth and COPC, we've had a wonderful partnership for years, something we wanted to continue. Keep in mind, Cleveland Clinic, it's all of their facilities domiciled in the state of Ohio. Unfortunately, I know it's not the new one they're building in, I think it's Dubai or Abu Dhabi, but Just the domestic Ohio ones is what we have, but it's combined 76 hospitals. And for our, ASO space, any large group over 100, what I'll say is we are that speedboat among cruise ship mentality. Let's talk about pricing methodologies. Let's talk about wrap networks. We have a relationship with MultiPlan. We use their PHCS national wrap network. It's almost 5,000 hospitals, basically facilities in every state, all 50 states. But we understand that there is a need to save money. We have actually partnered with 2 reference-based pricing companies. One of them is called HST. Funny connection for everyone on the call, their president's name is actually Ryan Day, so I cannot help myself every time I talk to him. He's a USC grad, but I gotta pull my Buckeyes in when I can. So their company goes down to 50 lives. We have a connection with Aetna's reference-based pricing company, excuse me. They go down to 2 lives. So, if we have a group, let's say the, ASO side, let's say they want to really save money, we can have the entire wrap reference base. Or, similarly, to kind of talk about the plug and play nature we can provide for Ohio Health's associate plan, what we set up for the associates is PHCS wrap is available for physicians and ancillaries only. We actually have reference-based pricing for all facilities. And our goal there was to potentially save the system millions of dollars. So that just shows the kind of plug and play. We can make things complex, we can make things simple. It's up to you, up to the group. But 5 to 99 are level funded plans. Anyone, if you see the highlighted, I guess, the dark gray counties, we have a 16 county service area. All businesses have to be domiciled, right, in this service area. But, of course, as we all know, if we have a business domiciled in Franklin County, and let's say there's a whole of employees at Muskingum, great, we'll take them. That's still fair play. Granted, on the ASO side, we can sell anywhere and, anywhere in the state. So keep that in mind. So big distinction here to recap: 5+ level funded ASO space. That's where you'll have access to reference-based price and the wrap network. Now, to be compared to our premier network, this is only ACA. We will have a POS and an HMO product. Now, the POS, the wrap, right? So any outside benefit is actually done at a percentage of UCR. We really did that to help the member. But the goal, guys, is to not have them exit our facilities. The reason why we have our price decrement that we do for our ACA plans is due to the high performance nature of the network. We want to guide people to our facilities where we can not only maintain costs, but we feel like we can dictate better health outcomes. We want groups to be supplied and work hand in hand with our care managers, our disease management, to make sure that their ailments are actually properly serviced and they're able to live a happy and healthy life. And like I said, year 1's big for us, but we're very cognizant about year 2, year 3, and so on. Moving forward, so this is just ACA POS system. We still have 22 plans other than 12 Ohio Health. Rattle them off the top of my head. We have Knox Community, Licking, Morrow, Fairfield, Pickaway. Gosh, I have a full list. Happy to share everything when we're off the call. So moving forward, right? I've talked about, kind of the background. I've talked about our rate position, our networks. Well, what's next, right? Our PBM. We have partnered with Express Scripts, and this is actually a partnership that we have had for several years. The big number I would say on this page is that right-hand sign, that shade of green box, the bottom one. It's almost $5 million of savings for OhioHealthy. $4 million in savings for OhioHealthy for 2021. Granted, this is 45,000 members, but that is a big number. Now, I mentioned earlier in the call our relationship, OhioHealth's relationship with an entity called HTA. Now, what is HTA? HTA is the Health Transformation Alliance, and essentially what it is, it's an organization that has groups like huge companies. I'm talking Apple, Intel, Google, massive provider-owned health plans, massive entities, private and public, and OhioHealth's included in this. And the goal of HTA is essentially have, everyone pool together to gain, strong economies of scale and purchasing power is kind of the simplistic way I can put it. But regardless, I get a lot of benefits being an Ohio Health employee because of Ohio's relationship with HTA. And what does it include, right? The top right in that box, that first check mark, Ohio Health's retail and specialty pharmacy. I'll touch on this again in about 2 slides from now, but all of our members have access to our 2 specialty pharmacies. We have one in our Marion Hospital and one at Riverside. Now, our specialty pharmacy anyone can come in, 30, 90-day supplies. They can get it, point of service right at the hospital, or they can actually mail order anywhere continental United States. So that is very big. But in terms of the care management side, right, another passed down benefit we get is our disease and care management programs. For instance, we have a copay assist program embedded in our CM side that goes to the PBM side. And it's essentially like, we'll put asthma as an example, right? We don't require anyone to go over hoops and ladders. What we'll do is say, hey, you have a specialist visit quarterly. It's virtual. Please get on this. You might have 2 in person a year. And they check on them, screening, make sure lung capacity is there, make sure, their medications are working. I actually have a colleague that is in SID program, and they can attest that the compliance in a program, she actually pays nothing for her inhalers. It is fully covered by OhioHealthy. Now that's a good benefit, but as she knows, and if she was on the call, she would tell everyone on the phone, it's all about compliance. As I said before, we don't believe in self-activation. So if she decided to not attend, a specialist virtual visit, or not attend a simple, screening in the hospital that might be done once or twice a year, she would actually be responsible for the cost of those medications. Those same programs, we will have one for cardiovascular. Obesity is just a general term. Asthma, MSK, and so on. So those drop down pass-through benefits that I get as an Ohio Health employee, your employer groups will get in our ASO space and level funded. So moving forward, other things I think about from a formulary or, PBM benefit from a consumer perspective, because that's the way we have to think of things at OhioHealthy. I think of really 3 things, ladies and gentlemen. First is, okay, what is the breadth of your formulary? How many medications are you offering? Is it enough to cover my needs? 2, how much do these medications cost? Is it going to hurt my pocketbook? Everything seems like it's increasing in price and medications are the same. How much damage is it going to be? And 3 is access. Hey, can I go to my favorite grocery store? Can I go to the mom and pop pharmacy that my family and I have been frequently for years? The answer is I think we have quality A+ rated solutions for all of them. So I'll start with the breadth, right? We almost have 2,000 covered therapies. A funny about this is when we were building ACA with Milliman, we were actually going to use our formulary that we have on the hospital side. Funny thing is that included actually 220 plus more medications than any carrier in the market to that state. So it's something that we really wanted to help our members with to offer them this breadth. So next is access, right? You'll see in the top left, 62,000 in-network pharmacy. Express Scripts is a recognizable name. Off the top of my head, who's involved, right? CVS, Walgreens, all the grocery stores. That's Kroger, Giant Eagle. We have Sam's Club, Costco, Walmart, Meijer. The list goes on and on. Once again, this is something that I will equip you with. Our broker toolkit actually has all this and more. So we solve things on that side. The funny thing is, we talk PBM, we talk the good old 80-20 rule when we talk about claims and things. Well, the pharmacy side isn't much different, folks. 2% of pharmacy claims, prescription pharmacy claims, make up about 51% of total pharmacy spend. And this is relating to specialty pharmacies. We really believe that our pricing and accessibility of our medications is of immense value to the member, but it's of immense value of, to you doing your job as a broker and for the employer in terms of costs, spend, etc. So moving forward, we talked about our PBM. Now let's go in and talk about what our level funded plans are going to be offering. As I said, this is backed 100% by Trustmark. Cornerstone is already appointed with Trustmark, so we are good from that side. But if you have worked as a broker with Trustmark before, I can simply say the same processes as they currently have, right? So in terms of participation, we will be having 75%, of course, minus valid waivers. We will be offering up to 4 plan options with the group, no penalty, none of that, no minimum plan enrollment. We have simplified underwriting for eligible groups of 35 eligibles or above. And from 5 to 34, we will require individual applications. Now, the reason why, and this was a lot of talks in the locker broker and GA feedback for this, we went with a level funded plan instead of MIWA, is because of the opportunity for a refund. We will provide 100% cash surplus after a 9-month rent out. And if you have worked with Trustmark before, one of the things that actually blew me away was their dashboards, was the immense data, statistical analysis, and so on in their dashboards. In my opinion, and what the board of OhioHealth thinks as well, is that we can equip the medical professionals with some of this information. The groups can easily track, their claim spend and make sure they're getting this refund. Like I said, we have these robust programs. We have these copay assists, these PBM benefit solutions to make sure that these individuals, get healthy or stay healthy. And that ensures that, hey, the employer's going to get money back. So we do offer 100% cash refund after a 9-month run out. Again, folks, all of this information, no need to memorize it, no need to take notes. I will provide this with you. For your information, it's obviously myself leading this channel, but I will have 4 individuals helping with scrubbing applications, quoting, processing, everything. So I will be the in-between between underwriting and obviously the broker, but we have a team that's ready to help walk through dashboards with the employer to make sure, from a medical sense, are you maximizing things? How do you look for the refund? What needs to be changed? So this is what we set forward with. As stated, right? Everything I've talked about and more is included on our 2023 broker toolkit. Now, what I really pushed, and I'm very happy that we were able to get this done. Obviously, we need to equip you with marketing and sales materials needed for you to do your job. But something I felt as being a broker in the past that would frustrate me is I thought, if a member or a group had an issue, sometimes it'd be pulling teeth to find solutions. Sometimes the thought might be, hey, I know what piece of paper I need. It's one thing, but I got to jump through all these hoops to get it. Well, we pushed forward and got it done. Any and all member-facing materials, including, what they were receiving for ID cards, forms, like that transition and care document, will all be readily accessed to you. Now, another caveat, which I pushed for as well, there will be separate logins, obviously, broker portal. Brokers will be able to look up their, commissions, book of business, all those things. Same with members, same with employers. But in terms of the toolkit, this is actually no login, nothing's needed. We really wanted to equip the market with all these materials. So that is something that, we push forward. All right, moving along, guys. Couple of slides left. Underwriting sales process, right? As stated, simply, all of these forms are on that toolkit I talked about, so no need to take notes here. Simplified underwriting is 35 or more. Everything else is under that. Now, Trustmark has some funny names for some things. The OhioHealthy RFP request sheet, and I put this on the toolkit, that is simply that, along with a member census, will get you base rates. I can get those turned around in about 2 days. Contingent offer, requires the other documents. That is about a 5-day turnaround time. That's what I'm getting. So Trustmark, it's like I said, I've been told by them it's the same way if you're used to working with them. That's what it is. And I've known from a competitive state, they have struggled in the market, but simply stated, I think full disclosure between you guys, their rates has changed drastically for 2023. Make no mistake, I think that is because of our entrance and our partnership, but the relationship is going to evolve and change over years. And I will say, from a broker and, me at OhioHealthy and us as an entity, what's going to win the day is constant involvement. So please, any feedback, positive, negative, anything in between, don't hesitate to reach out to me. As I said, the reason why we actually released level funding plans was because of direct involvement in collaboration of many brokers. I mean, there was about 24 brokers that helped create these things and advise, and we're all about that collaboration with the community. So make no mistake, we see you guys as the beacon of light, the trusted source of employer groups, and we will remain broker centric. Moving along. So these are the sheets I talked about: RFP request sheets, simplified underwriting, unique names, but once you open these forms, very easy. They're step-by-step by saying what is needed, what isn't. And keep in mind, our ACA quoting, we will have all on FormFire. My internal team can actually take censuses in-house, but we were telling, hey, utilize the GA for quoting and things like that. That is our preferred route, but we do have multiple options there. In terms of level funded, we can do things, obviously, FormFire, it's up and running on there as well. Or you can take the route of sending, the good old fashioned sheets via mail or email. So whatever you prefer, we can accommodate to. Licensing. So Nelson and team will actually communicate with you for a broker agreement and commission payment setup. Keep in mind, folks, our broker agreement has 2 signatures, one on page 7 and one on page 16. And our second form is to contract with Trustmark. The big news here is if you are currently trusted, if your brokerage or you as an individual producer is already contracted with Trustmark, great. You don't have to do anything other than fill out OhioHealthy's document. If you're not, it's 2 forms. Now, I will say all these forms are, form fillable, PDF. Take you a second to type in your name, send it over. But Cornerstone as a general agency will be providing this. And of course, you'll have access to me and my team if you have any questions. So last and certainly not least, I touched a second ago about us being broker centric. For your information, we do not and will not sell direct in the small group space. We have ambitions, pretty concrete, cemented ambitions to enter the individual market in 2024 and to enter the Medicare segment in 2025. And, for this to work, like I said, we are always going to remain broker centric. We can never see us having a, captive staff or really going direct to the market. We understand how this works. A lot of our team at OhioHealthy, you guys might know Justin Sinkowitz, who's my senior VP, who has been at United Healthcare for years. We understand the value you provide. We understand the value that the GA provides you as brokers. And we wanted to offer, $35 PEPM for all new business as a symbol of good faith. Thank you for working with us to help build these things, these products and programs. But also, hey, we are ready to be that community pillar. So that's what we're offering as a flat rate. We have also a broker bonus program. This will be from any sold employees, right? 100 to 199. You will get $15 per employee per year. Keep in mind, it's retroactive to the first employee. So we want all of your book counted for this. It goes up in echelon, right, guys? The 200, 299, $25 PEPY, 300 plus is $30 PEPY retro. Now we have the final perk we have is a gift vacation package that will be valued of up to $10,000. Simply stated, it is the producer that sells the most employees by the end of Q1. It's our broker, it's a compensation program that just one individual will receive. So this is what we're releasing to the market, and this is something we're very happy about. So without further ado, guys, I really appreciate taking time away today, getting on a call, learning about OhioHealthy, and hearing about our progress from being a joint venture with having new board members and hiring strategies, and now we're a wholly owned subsidiary for OhioHealth. So in terms of a community element, a community pillar, we will accomplish what we set out for. And it's the collaboration, between Cornerstone, between Nelson and his team, and everyone else on this call that's going to make that happen. So I appreciate the attendance. Appreciate you guys being here, and I'll open it to questions now. So thank you very much.
Hey, Sage. It looks like our first question is, what is the website for Ohio Healthy in order to pull benefit summaries, SBCs, et cetera?
So that is our broker toolkit. I can provide that link. Yeah, our website is called myohiohealthyplans.com. So
myohiohealthyplans.com. Okay, great. And as per usual with any new broker or carrier partner that we have here at Cornerstone, we'll be getting some checklists for you, posting those out on our document center in our that is open to you, that you can log on, along with all the collateral materials that Sage referred to today. We will also have a copy of this presentation so that you can go back and refer to maybe the hospital list, the counties covered, et cetera. And that'll all be out there at some point next week for your use. We would suggest that you direct your quote requests once you have them to your respective quote mailboxes throughout Ohio that you use already for Cornerstone. And if you do need to be licensed, we do recommend certainly that you are licensed as soon as you start quoting, so that if and when you get that very competitive offer and you're ready to go with it, nothing is held up for selling the group and proceeding forward with that. It's not a requirement, but it is recommended. So as Sage mentioned, there's a 2-component licensing. One will be to get appointed with Ohio Healthy or Ohio Health, and then the second will be to have the Trustmark, excuse me, appointment paperwork completed as well, which is one of our carrier partners here at Cornerstone. Do you see any other questions, Jess? That was the only one that I could see.
I don't. Just a quick caveat, guys. I don't know how it's one of those things, right? Is it Friday yet? I don't know how I forget to mention this. Quoting starts on Monday. So it's the 3rd of October. Everything's ready to go on Monday.
Perfect.
And a caveat, I guess, for the OhioHealthy plans, there's supposed to be a system update over the weekend. If you are trying to find some of the documents I referenced, I have a direct broker toolkit link. What I can do is send this to Nelson and team after this call for that to be distributed.
Okay, great. Jess, did you see any other questions? Oops, there's one other. And for quoting, I think the question is, will you accept another carrier's apps, or should they be downloading, for example, if you use the FormFire tool, as many of our Cornerstone brokers do, what would be the name of the application we should download, Sage?
Excellent. So we do accept other employers' apps, and it is just FormFire. Our rates are actually currently loaded onto FormFire from an ACA side, but it's other other carrier apps or FormFire.
Okay. And if they were using, using the Trustmark app? Is that what you're asking for then? There's not a specific Ohio Healthy app?
There are specific ones, and that is on the broker toolkit I showed you. So the RFP one, it's simply stated, guys, it's the same documents as Trustmark. It's branded us. So that's how they're going to tell the distinction. And because obviously we have 2 separate rates, we have a better rate position than Trustmark. That was confirmed. So that's why it's separate documents, but same content, I will say.
Okay, great. Jess, I see one more question there. I'm trying to get the full question viewed.
Do you want me to read it?
I think I see it. Will the network be available to lease for other self-funded business with independent TPAs in Ohio?
Good question. No. So that is a good question. So, like I mentioned, Medical Mutual, having our network for the ACA individual, are we going to kick Medical Mutual off? I don't think so. Are we going to make sure our rates is Ohio Health going to make sure we're the best rates? 100%. That's a system decision, I would say. And historically, they have been, 50-50 with some of those things. In the future, I could say probably 99% chance no. But that is a very good question, and that is a system decision.
All right. You see any others, Jess?
Nope, that should be it.
Okay, if you have any other questions, of course, you can always direct those to your broker advisors. We know this will be a more prevalent product in the Columbus, Central, and Southeast sections of Ohio, given the network. But certainly any broker advisor throughout Cornerstone can assist you with information on this, and we will get everything ready as quickly as possible next week when the quoting goes live. If you do have any further questions, I think we can adjourn for today, and we will be putting all of this information out on our resource center, which, as mentioned, if you attended our other webinars recently in the fourth quarter, you do need to register for that now. Really easy process to see the full presentations, and this will be, of course, recorded for anyone in your agency who might not have been able to attend this afternoon. But we appreciate your time. And thank you for joining us. Sage, thanks so much for the information. We're looking forward to it.
All right. Cheers, everybody. Have a great rest of your week and a terrific weekend. So we'll be in talks. Take care.
All right. Great. Thank you.
You're welcome.
Thanks, Sage.